Our guest this evening is Dr. Richard Collins, who is the director of the Ornish Program at the Heart Institute. I'd like to welcome Dr. Collins.
It's a pleasure to be here, Michael.
How exactly should we refer to some of these alternative healing arts?
It's an excellent question because in England it's called complementary medicine. In the Eastern countries, actually alternative medicine is their traditional form of medicine, and anything that deviates from that is called Western medicine. So it's interesting. It depends upon what culture you're at. It's probably the wrong term. Although it's interesting, and I just read this statistic, that we spend in the United States more money on alternative medicine than we do on traditional healthcare medicine in the United States. That's kind of interesting, but it's probably true. You look at people who have illnesses, they seek other means first before going through traditional ways of taking care of their disease.
What do you think the reason for that is? Why do you think they seek something other than the typical allopathic or Western medicine?
Well, there's a problem with the traditional medicine that we have. We're procedure oriented, and as long as we remain procedure oriented in this country, we really won't benefit the people that really have to use the medicine. We don't really make people feel better. We do procedures on them because that's the way payment is made, and that's the way the structure of medicine is today. So when we get into something that's prevention or something that deviates from procedures or takes procedures away, it's difficult to get that into the mainstream of traditional medicine, unfortunately. And as a matter of fact, if you look at medicine and the arts of the 1900s, it was healing medicine. And now it's the high-tech aspect of medicine that is a real problem.
Is it technology that has moved us away from it?
Michael, I think that's right. I think technology has moved us away. But on the other hand, we, in a sense, think physical. I can remember making rounds on a patient with a group of medical students, and went into the room, and I'll just use the name Mrs. Smith. I said, "Mrs. Smith, how are you feeling today?" And she said, "Well, I have this horrible headache. It's not going away." And I said, "Well, how are you feeling today?" And she said, "Well, also I have this awful backache as well." And I said, "Mrs. Smith, really, how are you feeling today?" And she said, "You know, I'm not feeling very good at all. My grandson, who I'm very close to, I've been in the hospital 5 days. He hasn't even called. I feel lonely, isolated, depressed." And now we're talking about elements that are so important in healing.
Feeling.
Feeling,
Yeah.
absolutely.
I read an article with Dean Ornish, and he said, we need to move closer upstream to the cause. And that's sort of what it sounds like, moving away from the procedure. We may be moving back to the traditional forms where we paid attention. How are you feeling? Mm-hmm. And moving a little bit away from the physical, rather than treating the symptoms, moving upstream toward the cause. And I'd like your comment on that. And also I'd like to ask you, where do you think moving upstream to the cause ends? In a theoretical or philosophical end?
Where does it end? It's interesting. Dean shows a slide that's very characteristic of medicine today, and there are surgeons mopping the floor, and there's this giant sink that is literally overflowing with water. And he compares that to the aspect that what we're doing is basically mopping the floor and not shutting off the faucet of causing heart disease. And that's really what we are doing. The Ornish Program gets right at the heart of the matter, so to speak, and that is, gets to the aspect of how can the heart be healed without having to do procedures. Mm-hmm. And I think that is really the aspect. Mind-body medicine is a totally new entity. It's opening up whole new avenues, but I can tell you that when the mind, body, heart are aligned, it's a very powerful thing. You can take care of heart disease on your own. It's a major lifestyle change, and that's what's incorporated in the Dr. Ornish Program. But we've seen it very successful.
Tell us about the Dean Ornish Program.
Dr. Ornish, a number of years ago, and actually this started almost 17 years ago when he was a medical student. And he was operating with Dr. DeBakey. And at the time, he was seeing all of these patients coming back for a second or a third heart operation. And he said, this is just not right. The surgeons are operating, but they're not taking care of the disease process. So he started to look at how possibly lifestyle changes could prevent second occurrences. He himself became extremely depressed when he was a medical student and actually describes this in his book, almost suicidal. He broke away from medicine for about 6 months to a year, and his family knew of a yoga instructor. And so he went and learned yoga and learned some introspective things for his own life, and finally realized that it was very powerful, that the feelings that he was feeling were the same things that other patients have that have heart disease. And he felt as though that this was such a very powerful thing that he could make a jump to some major lifestyle changes. So he decided if it was good for him, could this develop into a program for others? And as a result, set out 3 or 4 investigational studies, the biggest of which was a study done approximately 6 years ago, where he compared one group of patients, approximately 20 or so patients who decided to have the traditional medical approach, and another 20 patients who went through the same heart catheterization procedures but decided to go on a major lifestyle change. That lifestyle change was simply this, that to do this you would have to make a major change in your diet. That would require an absolutely, essentially a low-fat diet. Less than 10% of your calories would come from fat. You would have to become vegetarian. You could not consume any animal products other than non-fat dairy products. So that was the first step, diet control, bring that cholesterol down. The second step is exercise, moderate amount of exercise, incorporating it on a daily level. The third element is dealing with stress management, so essential. He realized that what was happening in heart patients is they're very isolated, very into themselves, don't share their feelings. Anger, hostility, all of these elements that we're known to be killers sit in there and rage within your heart. Stress management, using some yoga techniques, is very essential. The third thing is to break this isolation, is to empower group support, where you share your feelings with others. Share them and bring them out into the open through patients who already have heart disease. They started the program 6 years ago. The first year they published the results, and indeed what had happened was this, that the patients that were on this major lifestyle change had a reduction in their chest pain pattern. Their exercise ability moved to a whole new plateau. They felt much better, and basically their scans on their heart were improving. They were doing their own self-bypass. They compared themselves with the other group who went on to have bypass surgery, angioplasty, operated on in the traditional way. He looked at them then again by heart catheterization 4 years later and compared the two groups. And indeed, what he set out to prove was right, that a major leap in lifestyle change can not only make you feel better, not only can keep you from having procedures, but can reverse heart disease, a concept that we didn't think was possible.
Actually reversing it.
Actually reversing it. We thought that maybe we could stabilize it. But no, actually taking it away.
So we've got two groups. One group has no surgery, no drugs, but undergoes some 3 basic, or 4, including the group support. The 4 basic things being diet change, light exercise, stress management, some yoga techniques and so on, and group support. In other words, getting those feelings out and dealing with them, moving upstream toward the cause.
Absolutely.
This is one group, and that's all they did. They didn't do drugs, they didn't do the roto-rooter through the arteries and so on. And the other group did the Western typical surgical procedures, and the group that didn't do the procedures did better. Their heart perfusion was greater and so on.
They had 50% less clinical events. What is that? This would include having a second procedure, bypass surgery, angioplasty, or death, their cost of their care was much, much less. It was markedly reduced.
Give me a cost comparison. What are we talking about here? What it costs us?
It's a major cost shift. Angioplasty across the United States costs about $15,000 to $20,000, depending upon what center you're at. Mm-hmm. And a recurrence rate of angioplasty is about 30% to 40% in some centers. That means you're going to repeat the process again within a year. Bypass surgery costs anywhere from $35,000 to $50,000. And the disappointing thing about bypass surgery, in 6 to 7 years, you often have to have a second operation and repeat it.
Your background is in cardiology, so it's not like you're an MD who's coming out of left field. This is your specialty, right?
I've been in cardiology in practice for 17 years, and actually invasive cardiologist. Doing the angioplasty and all of those things that we were doing, I've quit doing it because I feel as though this aspect of the Ornish program is so powerful that I can do more good, so to speak, in the healing arts by doing this than shoving a catheter or a rotor-rooter down someone's heart. So I took a group of people from our center. We went out and we actually walked the streets of Sausalito with that original group. I walked with a gentleman who had triple vessel disease. Every blood vessel in his heart was clogged. A physician, a cardiologist, told him that if he didn't get his affairs together, he would be dead. Now that was 3 years later. I could not keep up with him in the streets of Sausalito. His energy level was incredible. His focus of life was better than mine. He was in control. He knew his feelings. His mind, body, and spirit and heart were all aligned. And I thought to myself, we can't give that by cutting on someone. That is an inner healing. And his chest pain had gone away. It was phenomenal. And so after looking at the statistics, I said, well, statistics are one thing, but going out and actually seeing the people who are part of the statistics, that's the thing that turned my whole mind around. And so then I started out saying, okay, I'm not going to put a patient on the program unless I can do it. So for a month, I became a vegetarian and followed Dr. Ornish's program. I've remained on that program now for the last 1.5 to 2 years. I feel much, much better. In the last 1.5 years, I had a little bit of high blood pressure. When I do yoga, it's so low that it hardly registers 98 over 50.
Wow.
And
talk about physician, heal thyself.
There is a thing that is in there, depending upon how this is focused here, Michael, your heart will follow, and vice versa.
Yeah.
And I talked to other physicians about the program. Well, do you believe that a low-fat diet will take care of it and reverse it? Yes, we do. Don't you think stress management is so important? Oh, yes, we do. You add up all the elements, and then finally they say, yeah, I can see where you're coming from. I think we are seeing a shift in the healing arts. And there's a couple of reasons for that. We have to do something with rising healthcare costs. There's no question about that. We have to stop being procedure-oriented. And I do believe that the answer in America is not to reduce the cost of each procedure, but just quit doing the number of procedures that we're doing. This is an option, and I think you're going to see the Ornish program a small beginning of other diseases, including aggressive management of diabetes with lifestyle change and this type of program. Other diseases, asthma and connective tissue diseases, and all of these can have some major support as far as how you are internally and how you can self-heal. When the money gets tight, you're going to see preventative programs now start to develop.
Dr. Collins, it's been a pleasure. Thank you very much. We're going to put away those old tapes of you at the Funny Bone, and we'll save them for the next show.
All right.
Thanks a lot for tuning in. That's our Heartland Healing Show for this evening.